I'm Dr. Todd at Stow Family Chiropractic, and today we're going to talk about spinal disc problems. Have you ever gone to the doctor and had, neck pain or lower back pain, been referred to an MRI, and then you had a diagnosis and you didn't really know what to do with, and the only thing they were offering was surgery? Good news. There's a non-surgical approach to this called spinal decompression therapy. So first of all, what is a disc? Our spine is made up of 26 vertebrae, which you have a spongy-like material, a disc, in between each vertebra. And this is 60 to 80% water, which allows us to bend and twist comfortably. Now, when we have a problem in the disc, it squeezes out, puts pressure on the surrounding nerves, which some people call a pinched nerve. This can cause pain, tightness, even numbness and tingling. Let's talk about the differences between a bulging disc, herniated disc, sciatic nerve pain, disc degeneration, and spinal stenosis, and how spinal decompression can help. What is a disc bulge? A disc bulge is when the sponge-like material on the inside of the disc squeezes out, puts pressure on the nerve, causing pain. Typically, the pain is usually pretty consistent, but it's more so with movement, like say, bending over, or say going from sitting to standing, or lifting something heavy. What is disc herniation? Disc herniation might be called slip disc. And this is when the inner soft material of a disc completely squeezes out and protrudes the outer shell and puts significant pressure on the disc, which causes pain. Most people have this in the lower back, and we feel it right over the injury site. This might cause muscle weakness and numbness and tingling. What is sciatic nerve pain? Sciatic nerve pain is caused for many different reasons. When it's caused by like a disc bulge or a herniation, it puts direct pressure on the sciatic nerve that can radiate all the way down to the back of your leg, which this causes, usually the symptom is pain, which travels the same path from your lower back down to your foot. What is degenerative disc disease? It's a condition on the disc that is caused from above normal stress on your disc over a lifetime. Now, unfortunately, spinal decompression cannot reverse the effects of this. However, we can prevent things from getting worse. What is spinal stenosis? This is a little bit more complex condition because you can have many different reasons why you have spinal stenosis. It's mainly when the disc degenerates, and then the canal where the nerve root comes out, it gets compressed there, and it could happen from like a bone spur or arthritis. And unfortunately, spinal decompression is not going to reverse the effects of arthritis. However, it can really help with the pain. What is spinal decompression? Spinal decompression is a gentle, non-surgical approach to decompressing the discs and the nerves. So how it works is we put this harness around her waist, hook her up to a digitally controlled unit, and over time it starts out slow and it starts to pull, and then it relaxes and pull and relaxes, creating a sponge-like effect in the disc, which absorbs the water back in the disc and ultimately raises up, takes pressure off the nerve. For best results, I recommend between 12 and 24 visits to start, 2 to 3 times a week, depending on the severity of your condition. We start with 8 minutes and we slowly build up to 16, and we increase the pull strength with each visit as well. So, you want to see how you can get out of pain and stay that way? Call Stow Family Chiropractic and see how spinal decompression can help you.